there was a very large lesion on the left side of his tongue, and it was not just from the broken tooth. And so I was like, I don't obviously know exactly what this is because my eyes aren't biopsies. Oral cancer screenings sometimes get overlooked. One of Susan's phrases she always says is it's more than just grabbing the tongue, because that's like what so many people have done for so long. They like stick out your tongue, move it side to side. Okay, that's the whole screening. But there's so much more going on. I think what hygienists can have a role in is doing some research on who are you going to refer to. Not every oral surgeon is the same. Not every ENT is the same. So do some research on who's in your area that's handling these types of cases and who's going to be the best person for you to refer patients to.
A tale of two hygienists.
And welcome back, listeners, to podcast A Tale of Two Hygienists. I am your co-host, David Torres, and I am here with my amazing co-host, Ms. Jessica.
Hello, everyone. Welcome back. And today we have a treat. I was perusing social media the other day, and I came across a very touching post. This post was posted by Deserving Dental of Colorado, and I saw that my good friend Alyssa Aberle was mentioned in this post talking about one of their beloved patients. And so we've invited Alyssa on today to talk about their patient Dorn. And I'm going to tell you a little bit more about Alyssa before we get into who Dorn is and what happened. So here we have Alyssa Aberle, and she is a Colorado dental hygienist with a deep understanding of our profession and a big dream for our future. Alyssa has spent her dental hygiene career working with several local nonprofit and community health organizations, including Kids in Need of Dentistry, Salud Family Health Centers, Colorado Orthodontic Foundation, Stride Community Health Center, formerly MCPN, and currently Deserving Dental, where I found the social media post. While working with these organizations, Alyssa pursued a master's degree in business administration to gain a deeper grasp on organizational management and leadership. Alyssa currently works in a mobile dental program serving homeless shelters and residential treatment facilities. Alyssa also educates dental teams on OSHA and infection control as a consultant with Laudenschlager seminars. Did I do that right?
That's close, yeah.
That's close. Laudenschlager? Maybe that's better.
It's a name. It's good.
Names are important to me. I like to say names right. Alyssa is passionate about advocacy and advancing the profession of dental hygiene. Married to a Colorado native, Alyssa and her family of 5 spend most of their free time outdoors hiking, backpacking, and boating in the most beautiful places on earth. Alyssa also loves rocking out to 90s music, movie theater popcorn, and chai tea. You can reach Alyssa at Linktree/Alyssa RDH. And we will also link her contacts for you in the show notes. Alyssa, thank you for coming, and thank you for a life well lived.
Oh, thanks for having me.
We're happy to have you. Tell us a little bit about Dorn.
Sure. So I work for Deserving Dental. It is a hygienist-owned dental hygiene practice in Colorado. Yep. A few years ago, it used to be called Dental at Your Door. That was a normal, like, for-profit dental hygiene practice. And Jen, the hygienist who started it a couple years ago, transferred everything into a 501c3 nonprofit so that we could get more funding and grants and things to help some of our patients. And so we are Deserving Dental. We are completely mobile. We go to different facilities every day. And a lot of our facilities are homeless shelters, substance recovery centers, transitional housing, places like that. And so we were at one of our facilities in Denver called Step Denver, and they're one of our favorite partners. They're awesome. But I met the first time this patient named Dorn. The first time that he came in because he said he had a broken crown that was bothering his tongue.
Mm-hmm.
And so he came in and was like, hey, I don't know, I haven't been to the dentist in a while, but I have this broken crown that's really bothering this side of my tongue. Is it something that you could smooth down? And I said, well, let's take a look at that. And I kind of explained to him our process that we're going to do a comprehensive evaluation. We're going to take some x rays. We're going to do an oral cancer screening. We're going to do periodontal evaluation, all this stuff. Well, as we're talking about this spot on his tongue that's bothering him, and I'm talking to him about it as I'm doing my intraoral and extraoral evaluation, I take a look at his tongue. And yes, there is a tooth that a piece of it has kind of broken off, like a kind of jagged cusp. But there was a very large lesion on the left side of his tongue, and it was not just from the broken tooth. And so I was like, I don't obviously know exactly what this is because my eyes aren't biopsies, so I can't tell him
Maybe one
exactly what
day.
this is, but I definitely knew that it wasn't just from the broken tooth. And so we have an ear, nose, and throat oncologist that we are really close with. We've had a few patients that we've sent to him. And so I immediately called his office and said, hey, I have a patient here. I'm going to refer him to you. What's the soonest you guys can get him in? And they usually do have a pretty long wait because he's a very in demand physician in the Denver
Mhm.
area. And they said, we can get him in. I think it was like 3 or 4 weeks. And I said, okay, I really think he needs to be seen sooner. But if he can only get in 3 or 4 weeks, what can we do in the meantime? And so they have a magic mouth rinse that they use. It's essentially baking soda, salt water. But, and I
Oh,
was like, yep,
different than the magic
yeah, it's
mouthwash that
not
I
the
know of.
normal, like, yeah, one. It's just like salt water with baking soda, just kind of helps neutralize symptoms. And I said, okay, I've already written down the recipe for that for him. Is there anything else he could be doing? And they kind of gave me some recommendations around nutrition and stuff like that if it was affecting his ability to eat, which it was. And so I said, okay, we're all set. We made him an appointment with them. We knew when that appointment was. We were keeping it on our radar as well. So when I went back to that facility a month later, we're there at that location once a month. He stopped by to talk to me, and Jen, our other hygienist, was with me that second day. And I said, how's this thing on your tongue going? And he goes, it's really hurting. It's gotten worse. He's like, I actually went into urgent care this weekend, and they told me that there's an infection because when I had done his intraoral, extraoral exam the first time, I also found a swollen lymph node in his neck on that same side, which again to me is like, okay, this is all connected. There's
These little red
something more
flags, these
going on.
bells going
Right.
off.
So when I saw him that second time, he said, I went into the urgent care. They told me that I had some kind of infection because my lymph node is swollen and it's draining some kind of infection. So they gave me a prescription for antibiotics, which just sent Jen and I through the roof. We were both like, okay, that is not the solution in this situation. And we were like, we need to call this urgent care and see if we can do a training for them on oral cancer screenings, because that's not really what needed to happen. But luckily, he did have that appointment already scheduled with the ENT oncologist, and so he got in. I think his appointment was just a few days after that. And Jen actually ended up going to the appointment with him because once she met him, she was like, okay, we're going to see how this goes. Do you mind if I come to the appointment with you? And he was like, oh, yeah, no, that's fine. So Jen went to his appointment with him, and she said it was really awesome because she got to see how they approach things from their side as this patient's coming in, the type of exam they did a scope down his throat to see if there were any other areas that were affected. They got him connected with nutrition supplements so that he was going to get insure sent to him through his insurance so that he could maintain his nutrition. And she just said it was really awesome to see that side of things. Well, they did a biopsy. It was squamous cell carcinoma, and they scheduled him for surgery shortly thereafter. And Jen actually got to scrub in on his surgery as well, which was pretty cool. But she got to like watch the whole surgery. They ended up removing 7/8 of his tongue, and
Wow.
rebuilding his tongue using his thigh muscle. And so she got to kind of see that whole process. Deserving Dental stayed in contact with him following his surgery while they sent him to a rehab facility because the facility he was living at couldn't keep up with his post-op nursing care that he needed. Jen got to meet his parents, and it just built this like really beautiful relationship. But he was always very open and willing for us to share his story even before he passed away, to talk about, what people should be looking for and how to get the care that people need and not to dismiss things that you think are normal. So,
And now correct me if I'm wrong, Alyssa, but he did not pass away from complications of the oral cancer.
I mean, they said it's kind of hard to tell because obviously those complications can be long reaching, but he just passed away in February, and that was about 2 years after we saw him for the first time. So he had had his full tongue reconstruction. He had been doing pretty well. He had actually learned to talk again and
Wow.
to eat again, which he wasn't sure if he would be able to do. He was actually a chef by trade and career. And so not being able to eat was one of his biggest concerns when he was talking about the surgery. So I mean, he had a really great recovery. He
Mhm.
was, out and about more than they thought he would be. But then when he passed away, they were like, it could have been, something systemic that
Associated.
was related. It's just hard to kind of pinpoint exactly what. But yeah, he lived for a couple of years, but unfortunately passed away just recently.
And left a legacy of relationship with dental hygienists and the importance of oral screenings. And I mean, when I read it, I was just really impressed with the relationship that you, Jen, and Dorn had with one another and the investment that Deserving Dental had in their patient base. And it just made my heart grow really big of these high dental hygienists owning a practice, investing in their patients, and improving their life for as long as they can.
I mean, and just I mean, they're your patients, you see them at work, but Jen got to scrub in on his surgery, and right before he passed away, we have the big National Western Stock Show here in Denver every January. It's like a big deal here, and there's the rodeo and there's all these things. And he had just texted Jen like a week before he passed away that he bought her a belt at the stock show because he was so excited because he saw it and it just looked like something she would wear. And just, those relationships can continue outside of your operatory. And there's just patients that leave those impacts on you. I mean, Susan Cotton, since we're talking about oral cancer, she's also here in Colorado and taught all of us what we know about oral cancer. She's done a few trainings with us at Deserving Dental, but she's like, she had that one patient who totally changed her perspective and made her prioritize oral cancer screenings and made her want to learn about it. And so you just have those patients that you meet and you're never going to be the same afterwards.
Alyssa, I wanted to double click a little bit on what you mentioned with the story as far as like, you said something that kind of caught my attention, which I think most hygienists say in their head, and that's kind of my eyes aren't biopsies, right? Like I don't know, I can't tell you for sure or for certain. And it's fascinating to hear the process of like, yeah, I think you have something going on and a patient coming in because there's a broken tooth and it's bothering the tongue to this amazing story, impactful story we just heard, right? Like the relationship, the bond, the the lifestyle change that created all of this. I have to ask for those of us that are listening to this episode that are just stuck on a rut, especially in this month of April, right? The awareness. What can we do to go that extra mile to level up our skills? Because oftentimes we get it from the patients too, right? Like they're coming in like, just polish these teeth, or I haven't had a cleaning in this long. But how do we evolve our verbiage from yeah, let's deal with what the patient is doing to hold on, stop everything. Something more important is happening. Here's what I can say to myself, right, as a clinician, and to the patient to give me that confidence of it's not just a simple, straightforward coming in, coming out appointment. What are some of the things that you recommend that we can start prioritizing or even saying to ourselves so that we can evolve the relationship and potentially have one of our stories, just like what you and Jen had with your patient?
Yeah, I mean, I think it's really easy when we're seeing patients to get caught up in like the checklist of everything that we have to do. And it's, you know, oral cancer screenings sometimes get overlooked. One of Susan's phrases she always says is it's more than just grabbing the tongue, because that's like what so many people have done for so long. They like stick out your tongue, move it side to side. Okay, that's the whole screening. But there's so much more going on. My dad had a friend who passed away from oral cancer a couple years ago, and I wish I could talk to his dental hygienist and his dentist and see if they knew anything was going on before he found it. But I think patients are, I mean, we're already kind of primed to be looking for signs of cancer, like they teach us what to look for in our moles that we have and our freckles. And, they teach women how to do a self breast exam. And so I kind of use some of that verbiage with patients. Some patients, they need to hear the word cancer to care, like some, if you don't say that word, they're going to be like, oh, okay, it's not a big deal. Some patients, that will deter them from following up on anything because they're scared of knowing that it's that. So you kind of have to read the room a little bit, but what I always kind of start with is we're going to start with an oral cancer screening. I'm looking for lumps, bumps, sores, anything that's different on one side than it is on the other, anything that has shown up recently or has changed recently. And I said, you look at your face every day. I don't. I see you once every 6 months, once every 4 months, whatever the case may be. So you're going to notice when something changes more than I am. So I'm going to talk you through this as I'm doing it because I want you to know what you're looking for. And so I kind of put that empowerment back on them, kind of like that self breast exam concept of like, you are going to notice if this looks different than it did the other day. The other thing I always tell them is anything that doesn't go away in 10 to 14 days, you need to pay attention to. So if you poke yourself in the roof of the mouth with a chip and you know it happened yesterday, okay. But if that sore is still there a month later, then that maybe it's not from that chip. It's kind of the thing with Dorn, like he had rationalized it. He had come up with a reason why he thought his tongue was hurting and why that was going on. And so I always tell patients, I'm like, a lot of times people will come in and they're like, oh, yeah, well, that sore, that's from when I bit my cheek. And I'm like, when did you bite your cheek? And they're like, a few months ago. Okay, well, maybe we need to pay more attention to that because maybe that's not the reason. So again, I'm trying to walk them through it and explain it to them so that one, they know what I'm looking for, but two, they can kind of take ownership of that as well. And then as I'm even when I'm doing my intraoral exam, I'm like, okay, I'm looking at the sides of your tongue, I'm looking underneath your tongue, I'm going to feel down along your jaw underneath your tongue. We're going to look in the back of your throat. I kind of just talk through it with them as I'm going. It's also a good time to educate them on the risk factors of oral cancer and that it's not just people who smoke and drink, because that's kind of the perception is, oh, well, I don't smoke and I'm young, so I don't think that's going to be the case. Well, most of the fastest growing population that's being diagnosed with oral pharyngeal cancers are under 50 years old non-smokers. So it's not just the smoking and drinking, it's HPV. Can we use that time to talk to them about HPV while we're palpating their lymph nodes? So I like to just talk a lot at them with them about what I'm doing and kind of use that time to educate them. And most patients respond really well to that. They're actually really appreciative because they're like, "Oh, I remember that they grabbed my tongue, but I never knew why." You know? So using that to educate them, but you're also building trust at the same time because they know what you're looking for.
It's like you're rehearsing your skill evaluation from hygiene school,
Yeah, yeah.
but with the patient, not with an instructor.
We have, like,
And
some scripts kind of that we use, and I'm like, I describe something the same way 5 times a day. The dental assistant that works with us, Letty, I'm like, "You're probably sick and tired of hearing me say these same things over and over," and she's like, "No, but it's consistent." So, like, everybody's getting that same education, that same information. The other thing is, if you only tell certain people information, you're kind of deciding ahead of time if you think that that's gonna apply to them or, like, if I'm only telling people over 50 who are smokers about oral cancer, or I'm only telling certain people about HPV, well, I've already kind of decided if I think that's information they should have. But if I'm consistent with everybody, it kind of takes that stigma and that judgment out of it too, because I'm just telling you the information no matter what, whether it applies to you or not. And then maybe it doesn't apply to them, but maybe it can apply to somebody else. We had this one guy at the same facility actually, who his first oral cancer screening was actually with his PCP, which I was actually very impressed by. And he was telling me, "Oh, yeah, they did all these same things. They were feeling this, they were feeling this. They told me they were looking at this." And he said they talked him through it like I did to the point where he's now doing oral cancer screenings on his friends and family. And he was like, "I've been
great.
doing it on everybody. I found a lump the other day on my friend, and I'm gonna tell them they need to go see their doctor." And I was like, "This is it, but this is it, right?" We're taking that stigma and that fear away from it and just being like, every woman's doing a self breast exam, if or you should be. Everyone's gonna go get a colonoscopy, whether you have the risk factors or not, because we don't know. We don't know what we don't know.
And the key is finding it early.
Exactly.
That's the key, to find it early. And I wanna talk about how there is a standard of care that we were all taught on how to look for those abnormalities. And you made mention that Susan took you to a new level on what you're looking for. What are 2 or 3 of the things that leveled up your oral cancer screenings?
Well, I mean, I'm fortunate. Again, I work for a hygienist-owned practice. I only see 5 patients a day. I have 90 minutes with each patient. So,
This is
I
just
know.
tickling my
I know.
soul.
So I know
I'm
I
so
live in a
happy.
little bit of this dream world, but I do think having enough time to do a thorough exam is important. I know we have a million other things to cram into an appointment, but this literally saves lives. This literally can be the thing that saves somebody's life. And so you don't want to just breeze over it. And so I think again, we kind of take what we know from school, all the structures we're looking at, right? There's like a whole list of intraoral, extraoral, oral pharyngeal structures that we're looking at. And we have this like super thorough list. But then we get into practice and we're like, well, now I only have 2.5 minutes to complete this exam. I'm going to look at the big ones. I'm going to palpate the thyroid. I'm going to maybe feel quickly along the lymph nodes. I'm going to look in the back of the throat. I'm going to move the tongue. That's it. And it's like, well, yes, but some of the more common places for cancer to occur are not as easily seen if you're rushing through it. So making sure that you can see well, that leads to having proper lighting and vision too. Like I always wear my loops and I always
Mm.
make sure that I have good lighting because there are those patients that you can't see the back of their throat and you'd be inclined to just be like, "Meh, we'll just skip over it because I can't really see it." That's not gonna work. So, I think you've been given the tools, but then you get into practice and people say, "Well, that's not the real world. That's just how you do it in school." But
There's a reason why I work at school.
I would say the real world is where we need the people who are doing this. So I think one of the things Susan really ingrains in everyone who takes one of her courses is to do not just do an oral screen cancer screening, but do a thorough oral cancer screening and make sure you're looking at all the structures. But again, that takes a little bit of time. So I think that's the biggest thing I hear from people is I just don't have time to do all that. It took up a third of my appointment. And I'm like, and so be it. Like, you know, I don't know anyone, no offense to anyone, but I don't know anyone who's ever died from some stain being left on their teeth. But I do know people who have died from oral cancer. So
And
I would say it's one of the most important things we do.
and something that we have an opportunity.
Mhm.
Yeah, and I think it's kinda going back to, like, guys, like, if we're taking X-rays, those of us who start taking X-rays, like, the full set, we're intimidated it's gonna take, like, 20, 30 minutes, but then we get experience and we do them faster. But then we also look into art. Do we have, you know, cone cutting? Do we have overlapping? What's the point of taking X-rays if we're gonna have all those, errors in a film? Same thing with oral cancer screening. Like if you're gonna do it, take your time because it is a life changing exam. And those are things that I want to be able to kind of encourage our listeners and understand that we have a certain responsibility, right? To be able to not checklist everything just because of the necessity of doing it, but just be understanding that the importance of doing it is why it matters. Like,
Mhm.
let's not cut corners because we're running out of time or because the next patient is already in the waiting area or because this specific patient showed up 15 minutes late to our appointment, right? Like, I've been doing this for over a decade, and there are patients where literally everything stops because you just witness something that you weren't counting on, and sometimes that could be oral cancer,
Mhm.
right? And we all need that one case. And I hate to say this out loud like this, but most of us need that one case to kind of redefine on why we do things the right way.
Yep.
Because I would imagine those who have never seen oral cancer screening in the chair are the ones that are probably doing it like a little bit fast or forgetful or skipping over, not because they don't mean to, it's just because it's not relatable to them.
Mhm.
They haven't yet had that patient that is like, oh my gosh, like I made a difference, right? And you mentioned tools and skills. Is there others? I mean, we can't all be at the ENT with an endoscopy, right? Like we can't do all that. But what are some of the tools that in our career we could use, like things like Velcro, Visalite, or if we don't have any of that, what can we do?
I mean, there are a lot of devices. Susan, also at our Rocky Mountain Dental Convention here in Denver, the last couple years, we've done a like screen the screener area
Mhm.
within the exhibit hall where Susan and Lanny and myself and some other folks from the area, we will actually just as people are coming through dentists, hygienists, dental assistants, front office team, as they're coming to the convention, we'll do an oral cancer screening on them. And we've used quite a few tools there. We've used the BioScreen, we've used Velscope. I don't have any of those devices with me at Deserving Dental. Are they great? Yeah, they can be, but I think also sometimes we kind of rely on them, like, "Oh, well, if I don't see anything with this," and then we kind of lose that tactile part of the exam. The tactile part of the exam is super important. So, I mean, they can be great, but I don't think just because you don't have one doesn't mean you can't do a thorough exam. I think our biggest thing is we're just identifying something that needs to get referred. Like we don't have to know everything. I know we went through oral pathology. I don't remember a lot of the different types of pathology, honestly, but I know what doesn't look right. So another Susanism is if it's not right, it's not right. So I know that it doesn't look like the other side of the throat. I know that that tonsil looks different. I know that that side of the tongue looks different. I know that if things are hard, immovable, multicolored red and white combination, have grown recently, is new. Those are things we definitely want to be referring. And so the biggest thing for me is I don't have to know it, what it is. That's not my
Mhm.
job. My job is to identify it and get it referred to the right person. What I hear from a lot of hygienists sometimes is, well, I saw this patient, I found this thing I wanted to refer, but the other hygienist or the dentist or somebody else in the practice didn't really think it needed to be referred, so we're just gonna watch it. And just like a cavity, what are we watching it do?
Do
Get
flips,
worse? Yeah, like,
do the
this
splits,
is
I don't know.
not this is not the approach. So, I think what hygienists can have a role in is doing some research on who are you gonna refer to. Not every oral surgeon is the same, not every ENT is the same. So, do some research on who's in your area that's handling these types of cases and who's gonna be the best person for you to refer patients to. Who are you gonna have be able to have open communication with about the cases once they've seen them. Because of our relationship with this ENT oncologist here in Denver, I knew exactly who I was referring that patient to, and I had full trust that they were going to be taken care of there, and so I can give that reassurance and that trust to the patient of, like, "I know this office individually, and I know that you're gonna be in good hands." So I think hygienists could take more of an active role in who are we referring to? What does that process looks like? When are we referring? What's the process for getting feedback back from that office? I think that's something that hygienists could do in their office and make a big difference.
Hygienists, you are healthcare providers,
Yes.
and you do have tools. You have tools right now. You have the tool of time. How are you using your time? You have the tool of tactile sensitivity. How are you using your hands? You have the tool of team. Who's in your team? Like, who is on that team that you're going to be referring to? Because your eyes aren't biopsies. Your hands aren't biopsies. The only thing that's going to let us know what it is by taking a piece.
Mhm,
So refer when in doubt, refer it out. And then if they're in doubt, they'll cut it out and
mhm.
figure out what it is. And so I hope that hygienists that maybe have not had the experience of having someone like Dorn in their chair and seeing the result of a good cancer screening, that they will listen to the podcast and use your experience, Alyssa, and not wait to have that experience before changing the way they screen their patients. So, tomorrow, when you're back in your office, I want you to remember Alyssa, and I want you to remember that you can be thorough and you can change someone's life. So, thanks for listening.
And guys, honestly, what a great idea would it be to go to work and screen each other, calibrate each other. If you can't do the whole team, start with the other hygienists, right? What are some of the things that you guys are saying to each other? Or at the very least, just share this episode because I believe that we, as healthcare professionals, just like Alyssa and Jazz, we can make the world difference and oftentimes save a life.
Just takes one.
Just takes
Thank you,
one.
Alyssa.
Thank you guys for having me.
That's a wrap on today's episode of A Tale of Two Hygienists podcast. If this conversation made you feel seen, inspired, or even just a little fired up, share it with a fellow hygienist or fellow dental professional. Share it with your neighbors, your friends, share it with everyone. That is how this community grows.
Make sure you subscribe, leave us a review, and connect with us on social media so that we can keep on going with this conversation. Remember, your career, your voice, and your story matter here. We're David,
And Jessica,
and until next time.
keep learning, keep laughing, and keep showing up for yourself and for each other.
This has been a production of Endeavor Business Media, a division of Endeavor B2B.